Hello friends, the month of September highlights the cancer awareness for many cancers. These include the gynecological cancers, urological cancers, blood cancers, thyroid cancers and childhood cancers. Today we will talk about the childhood cancers because childhood cancers are often ignored and are of a lot of importance. Worldwide, if we see, there are almost 4 lakh new children who are diagnosed with cancer every year. If we talk of our country, the incidence of cancers in minors, which means those who are less than 19 years of age, is approaching almost 15%, which is enormously higher than the Western world. So, what could be the causes of childhood cancers? Unfortunately, the causes for childhood cancers are not known in majority of cancers. Genetics plays a role in approximately 10% of cancers. In some cancers, there has been association with certain viruses, that is the Epstein-Barr virus, the HIV infection, and also human papilloma virus. But of date, majority of cancers do not have any causative agent. Similarly, we really don't have any screening tools to pick up some, genetic or some other cancers early. But it is of importance that whosoever is the caregiver of the child should be watching the child in many contexts and should notice subtle signs such as the child is getting pale, the child gets bruised by small injuries, the child is losing weight, or when you're bathing the child, you appreciate some lumps or any other such things in the body. Because the commonest cancers which happen in the childhood are the blood cancers, the brain tumors and the lymphomas. There are certain solid tumors also which are more common in childhood. These include the neuroblastomas and the Wilms tumors. Wilms tumors are tumors of the kidneys. So usually the child will have distension in the abdomen. So these are the things the parents or the caregivers need to be taking precaution while raising their children. Another common tumor in childhood is retinoblastoma. This again is not a very common tumor, but usually the noticeable thing which you can see in the child is the pupil becomes white. So if there is a white pupil which you call leukocoria, or the child's eyes are converging, diverging, there is some sort of a squint or there is a bulge in the eye. These are the things which should catch your attention and you should seek a medical consultation. Apart from all this, I think there is evidence that children should be screened for non-communicable diseases annually, which include many other diseases apart from cancer. So make sure that your children are immunized for their age for all the available vaccines, and they are well nourished, they are being annually screened for NCDs, and if you are keeping a watch, these should be giving you a clue on certain diseases which may include cancers as well. Thank you so much.